The following program contains mature subject matter. Viewer discretion is advised. Dr. Nita, an ice cube vagina challenge is making the rounds.
Apparently, they're saying that putting an ice cube in your vagina can help with things like depression, vaginal tightening, and also genital warts. Yeah,
we do freeze warts, and I suppose that it's so cold that it's like shock therapy and may reboot your depression, but I don't think so.
The depression, to me, putting an ice cube in your vagina makes it like you probably would be a little sadder than you were before.
Yes, you would.
With a cold vagina. So I don't know where they got that one from. The tightening, maybe, so that's wrong. The tightening, I'm guessing, you know how when you get really cold, your skin can kind of shrivel up? Maybe they're thinking that, but that's also a no. And the genital warts, I think you're on the right track. They're thinking that it's the same as the cryotherapy that we use in the office to freeze off warts, but no, it's not cold enough. It's not going to do that. If you think about it, we ask you not to douche ever because we don't want you putting things in your vagina that can disrupt the balance between the good bacteria and the bad bacteria. So if you use ice cubes, that's water and it can disrupt things. And also it can stick and that can be painful. And you don't want your vaginal mucosa to be that cold. It's a no across the board. It's not going to help your depression. It's not going to make your vagina tight, and it's not going to get rid of your warts.
Keep your ice cubes in your cocktail.
Yes, don't let TikTok mess up your vagina.
All right. How about these things they're calling vaginal moisturizing melts?
Apparently, these melts are supposed to make your vagina smell or taste like what you're putting in there, which will happen, but be mindful of what you're inserting into your body. When you're buying all of these things off of the internet and you're doing all of that, then you're getting these chemicals and ingredients, and you don't always know what you're getting. And you want to be very careful. Less is more. Your vaginal mucosa is very sensitive. So I would say stay away from that. And I will, however, say that vaginal moisturizers that are over the counter can be beneficial when it comes to postmenopausal women or women who have a lower estrogen for some reason. I really like using an over-the-counter moisturizer 2 to 3 times a week, along with a lubricant when you actually have intercourse. For some women who are in the menopause transition or postmenopausal, even using the vaginal moisturizers or lubricants is what we do before we get to a vaginal estrogen. So I like moisturizers, but not the ones they're talking about.
No, food is not meant to be put inside. All right. Next up, herbal suppositories.
I'm just very protective of vaginas in general. And I go back to the motto that less is more. You have to know what's going in there. Nobody's regulating what's in these suppositories, really. So it's a no for me. If these things haven't been proven scientifically to work individually, then don't just mix them together and think you're going to get a better result.
Dr. Nita, you are Gynomite.
Thank you, my friend.
You never disappoint. Thank you for coming. Great tips, and thanks for setting the record straight.